Okay, some of my patients come in with something known as tennis elbow. Well, we tend to think that the elbow itself is where the issue is coming from. So it's important to know what they're doing. I know it says tennis elbow, that's just the name of it, but a lot of different things can do it. So it really is just pain that's on the outside of the elbow here. One of the things that I see often in here is there's a shoulder dysfunction that's going on with this. So you'd say, but wait a minute, it's my elbow. Well, this is how I test it to see if it's actually working. What it typically is, it's overuse of this muscle here. But Evan, go just like this once. Yep, turn it back and forth. Can you see how the bicep is moving? Well, your bicep is a helper in that action, okay? So we need to see if that's actually working, okay? So let's just see how this is all working right now. So I'm gonna take it and I'm gonna have him resist my movement this way. Hold, okay, and it blows out. Well, if I go in here, it'll be really sore sometimes, okay? Typically that's why, because it's tennis elbow. But this will be very weak. And what I do is I come right up here, and when I feel here that I have a lot of pain in the front of the elbow, or the shoulder, so this is gonna secure this tendon in here, and now hold, and it strengthens right up. Now here's the other thing about it. So we're gonna do something called a speeds test. This is a typical orthopedic test for the shoulder, what we call long head of the bicep. And I'm gonna have you hold that, please. Hold, and it goes weak. Couple things, if I secure that tendon and now hold, it goes strong. And I'm going to rub the back. This will typically be very sore in somebody if I rub the back of that shoulder blade. What I'm doing is creating some stimulus in the back of that shoulder blade that'll put that shoulder back into neutral, and now hold, and it goes strong. So what's the moral of the story? The moral of the story is the bicep isn't helping in this action. In particular, it's the outside portion, and that tendon rides in a groove. So as this muscle gets weaker and weaker, the shoulder rolls more forward and forward. And at some point, that tendon is getting displaced out of that groove. Think of it as like a shallow pulley. If you're pulling a rope, it looks really good this way, but if you step off to the side a little bit, that rope comes out of the pulley. That's what's going on here. And then as a result, you can't generate the power for the bicep to help, and all the work is done now just by this small little muscle. And where that muscle inflames or inserts on the bone, it gets very inflamed. You get a local inflammatory response. So moral of the story is, don't just look to the area of the pain, look elsewhere as well to make sure you've ruled that out as well. That's it.